The second practice we're going to do, and the second thing we're going to look at, is nasal breathing. Now, we're going to cover as best we can here, but I do recommend also that you go to my YouTube channel and look at the YouTube channel, because there's a fantastic video on there about nasal training. But we're going to cover this. So, first of all, what I want you to do is breathe in through your mouth. And as you breathe in through your mouth, feel what's happening here in your nose, just above these nares here, these bits here. Feel what's happening here, and feel what's happening at the back of your soft palate. If you try it and feel it in, breathe in through the mouth and feel it. And what you might feel, because the pressure changes going in through the air going in through your mouth, is that these bits shut down here, and the soft palate at the back of your mouth lifts up. So when we breathe through the mouth, it shuts down the nasal passages. Put your tongue on the top of the mouth, right at the cerebral point, that's at the peak, right at the top of the hard palate, and press it there. And breathe in through your nose, and feel what happens in the soft palate. If you can't feel it, take your tongue out of the way, but feel what happens when you do a nasal breath. And the soft palate drops down. So, how we breathe is entrained. How we breathe is learned. And all of these tissues around here, it's not just a tube going through your face. All of these tissues are learning tissues, and they're responding to the demands we make on them. So if we breathe through our mouth all the time, our nasal passages are shutting down. Well, why does that matter? What does it matter where we breathe? Well, nasal breathing gives us about 30 advantages over mouth breathing. Mouth breathing tends to bring breath up into the upper chest up here, and that breathes into dead space. It doesn't get air right down into the alveoli, which are more at the bottom of the lungs. It doesn't activate the diaphragm in the same way. And mouth breathing tends to switch on the sympathetic nervous system, the stress-based nerving system. So if we want to reduce stress, then mouth breathing really isn't that sensible. So mouth breathing also doesn't hydrate the air in as well. It doesn't get rid of particles, viruses and bacteria out of the air as well. So there's a whole range of things about mouth breathing that are problematic. We know that mouth breathing also changes the shape of the face, the structural shape of the face, and it can cause dental problems. It can cause metabolic problems. So mouth breathing is part of creating cardiometabolic disorders, things like irregular heartbeat rhythms and eventually even heart attacks. So nasal breathing is how we've evolved to breathe. There isn't a single mammal on this planet that breathes through its mouth. Dogs don't do it. Dogs, when it's panting, is just bringing air back and forth across its tongue to cool down. It's not breathing through its mouth. Right? Nasal breathing, we have to open these tissues up. If we snore at night time, so that we're training our nasal passages to close, it's harder to nasal breathe. If we go running and we're mouth breathing, it's harder to nasal breathe because the nasal passages are shutting down and we're training them into closure. If we look at our culture, you go to the movies and you watch what happens in the culture, you'll find whenever somebody does a lot of effort in movement, they're going to be mouth breathing because that kind of shows, in a Hollywood movie at least, effort. Or when somebody's really emotional, they do mouth breathing. So our culture teaches us to mouth breathe. What we're learning is to breathe nasally, to breathe in and out through the nose. And this is the least stressful way that gives us the most benefit. And the benefits include elevated levels of nitric oxide, which is antiviral, antibacterial, and a vasodilator, so it increases oxygen uptake in the lungs. The epithelia at the top of the nose, when we breathe in, is activated. The erectile tissues in here are activated. So what can also happen is we get activation of the limbic system when we increase the sense of joy. So there's all sorts of positive benefits to nasally breathing, and basically it's a way to breathe that encourages a greater level of relaxation as long as it's not stressful and difficult, as long as our nasal passages haven't shut so much that it hurts to breathe through there. So best you can, breathe through the nose as often as you can, as fully as you can. And if you go running, you can train yourself in nasally breathing. You breathe in through the nose to the count of 3 or 4. And breathe out through the mouth. To get these passages open, you can massage in here. You can massage all the way around the nose like this, getting the fingers here, rolling big circles to get this open. You can sniff here. You can get your fingers into the points in the skull. You can feel under the skull here and get in here and press in here and spread open across the face like this as you breathe in. A way to facilitate that even more is to press the tongue at the top of the mouth. So if you press the tongue at the top and breathe in here. Breathe out through the mouth is okay, but breathe in through the nose. And start to train those tissues open. If you tie your hand up with gaffer tape and bind it so nothing can move and leave it there for a week or two, you take the gaffer tape off, you won't be able to separate your fingers because your brain will have translated that as one chunk. And then you have to do a practice of pulling the fingers apart like this to get them moving again. That's self-applied neuroplasticity. So you're recreating, so you're finding the sensory movement to recreate the motor movement. If you spend a lot of time breathing through your mouth, all this is going to be shut. So you have to spend time opening. You have to train your nose. This is nasal training. That's what the video on YouTube is about. So using the massaging principle, using your tongue in place, do the best you can to get your nasal passages more open. Now, in the beginning, this muscle here will switch on as well. Orbicularis will switch on, and your face will switch on, the muscles around your eyes will switch on, because it's like that gaffer tape around your hand. So what you're learning to do slowly is to switch off the other muscles and just switch on these ones here on the nares and these ones here, transversalis, nasalis transversalis here on the sides of the nose, to be able to activate those nasal passages. And breathe in without the forehead muscle switching on, without the cheek muscle switching on, without the eye muscle switching on, without the mouth muscle switching on. And you can help that with the tongue in place, either behind the top of the teeth, at the back, the roots of the teeth, or on the top of the mouth. So nasal breathing is really important. And as you're going to breathe nasally, as you're going to breathe in through the nose, put one hand on your belly, tongue in place. And see if you can breathe into the belly, expand this belly out like a balloon, slowly and steadily. And just relax on the exhale. Breathe out through the mouth if you want to. And if you want to breathe out through the mouth, make it like a straw shape. So you can breathe out really slowly. Or breathe out through the nose. But nasal training is really important so that you can breathe nasally. And if you have a habit of mouth breathing, start to catch yourself doing that and stop it. Use the stop practice. Stop, take some nasal breaths. Observe how you feel, observe your body, and proceed from there and continue nasally breathing. So it's something you have to interrupt as a practice. So nasal breathing is really crucial for your well-being, for your ongoing well-being through the rest of your life. And it's crucial for helping you to resolve stress. Now, when you're doing nasal breathing, you've got to stay clear in here. If you start to go fizzy and dizzy, you know you're breathing more than your metabolic demand, you're going hypocapnic. That is, you're going into a place where you're blowing out carbon dioxide and you're reducing oxygen getting into the brain because you feel fizzy and dizzy. That's the outcome of that. So if you're clear and here, present, bright, fresh, as you're doing it, you're doing all right. So practice nasal breathing. Practice it every day until you get it down. So every breath you breathe becomes a nasal breath, and it becomes a nasal breath of comfort and ease. And as you slow the breath down on the inhale, you can lift the air up through the upper nasal passages, through the upper, there's 3 tubes through here, 3 passageways. You lift it up through the upper passageway, and that activates that olfactory epithelium, the erectile tissues in there, and it switches on the default level of joy in your brain that is just so sweet to feel. So take your time, slow it down, breathe in slowly, spread your nostrils, get the nose working. Fantastic.